Alright, hello, my name is Reggie Gilstrap, and this is my final head to chest assessment. Just me, the student nurse. Hand hygiene, provide for patient privacy. Hello, Mr. Gilstrap. My name is Joey. I'll be your student nurse for the day. How are you doing?
Good, how are you?
I'm doing alright. So, the purpose of today is for me to conduct a head to chest assessment. It'll probably take about 15 minutes. Is that okay with you? Okay, so to get this started, I need to get two patient identifiers from you. So, can you tell me your name and date of birth, please?
August 30th, 2008.
Talon Gilstrap. Okay, awesome. And then can you tell me whether or not you have any allergies?
No,
No allergies. Very good. Okay, so we use something called a pain level to assess your pain, okay? The pain scale goes from 0, which is no pain, to 10, which is extreme pain. Can you tell me what kind of pain you're in right now?
0.
0, so no pain. Awesome. Okay, so that's good. So let's get this started. So the first part of the assessment is general appearance, and what I'm looking for are any signs of acute distress, okay? So when I'm looking at you, I'm looking at your behavior, I'm making sure you're not acting erratic, I'm making sure that you're not diaphoretic, you're not leaning forward with shortness of breath or having difficulty breathing, okay? You're not using accessory muscles when you're breathing, you're not panicking, you're not fidgeting, you're looking normal, okay? So I don't see any signs of distress. No signs of acute distress, okay? So next I'm going to check out your level of consciousness or alertness, okay? I'm going to do this by asking you a series of questions, okay? So can you tell me your name? Alright. And can you tell me where you're at?
The hospital.
The hospital, okay. And can you tell me what time it says on this clock?
8:15.
8:15, okay. And can you tell me why you're here?
General checkup.
General checkup. Okay, so you answered all 4 of my questions right, which means that you're alert and oriented times 4, okay? So the next part of this is I need to assess your behavior, which involves your facial expressions and your mood, okay? So while I've been talking to you, your facial expressions and your mood and your behavior, I feel, have been appropriate for the situation. Okay, you're not being rude, you're being nice, polite, you're answering my questions, you're sitting upright, and you're looking, pleasant. So I don't see. I would say that your behavior, your facial expression, and your mood are appropriate for the situation. Okay. I've also been paying attention to your speech, and what I've been looking for when it comes to your speech is making sure that you're speaking in complete sentences, making sure that you're being clear and concise, and that you're making sense. All of what you're doing, okay? So your speech is good. It's within normal limits, okay? So your vitals were taken before I came in here. Your temperature was 98.6. Your heart rate was 80 beats per minute. Your respirations were at 16 respirations per minute. Your SpO2, or your oxygen saturation, was at 98%. And then your blood pressure was 110/70. All of which are within normal limits, okay? So the next part of this assessment is assessing your skin and nails. So I'm going to assess your skin first, okay? Now, when it comes to assessing your skin, just a heads up, in a hospital setting, my patient would be in a gown and I'd be able to assess and inspect his skin underneath clothes. But for the purpose of the video, my patient has clothes on. So as I stated, I'm going to inspect your skin first. And what I'm looking for first is the color, okay? I'm making sure that your color is appropriate for your ethnicity, which it is. Your color is appropriate. Your skin color is appropriate for your ethnicity, and it's even throughout. Okay, so it looks good. The next part about inspecting or looking at your skin would be identifying any lesions, wounds, or incisions, okay? I'm looking at your anterior side, which is your front side. I don't see any signs of incisions, wounds, or lesions, okay? Can I look at your posterior side, so your back? Alright, awesome. I don't see any signs of incisions, lesions, or wounds on your backside either, okay? So your skin looks good that way, okay? So the next part is inspecting your nails. So I'm going to look at your nails, and the first thing that I'm going to look at to see if you have any signs of clubbing, okay? Now, when I'm looking for clubbing, what clubbing is pretty much an abnormal curvature of your nail, which is a sign of not so many great things, okay? I don't see any signs of clubbing. I'm also going to look at the color of your nail, okay? Color of your nail is appropriate, okay? It's within normal limits. It's pink, okay? I want to check your cap refill rate. So what I'm going to do is I'm just going to press down on your nail bed and make sure that blood is getting back to your tissue within a good amount of time, okay? Patient's cap refill is within 1 to 2 seconds, which means that's within normal limits, okay? The last part of assessing your skin is I'm going to just check your skin temperature, okay? And I'm going to do that by just touching with the front side of my hand right here, okay? And I'm just going to touch your extremities and assess your skin temperature, okay? Okay, so your skin temperature was warm and it was moisturized, okay? Which means it's good, okay? The next part of this assessment is assessing your head and your face. When assessing your head, what I'm looking for is I'm going to palpate your head, and I'm going to make sure that you don't have any signs of infestations or any lesions, okay? So is it okay if I touch your head? Okay. Patient shows no signs of lesions or infestations, so it's good, okay? Then I'm going to look at your face, and what I'm looking for is symmetry, okay? So make sure that your facial features are symmetrical, okay? So the left side should match the right. You look at me? Alright, so your facial features are symmetrical, okay? So it looks good. The next part of our assessment is your eyes. And what I'm doing with your eyes is I'm going to inspect the external ocular structures. This would include your conjunctiva and your sclera, okay? And what I'm looking for is any signs of redness, any discharge or drainage, okay? So I'm just going to look right now at you and see if I see any signs of redness or discharge or drainage. I don't see any signs of redness, discharge, or drainage. So I'm going to pull down and look at your conjunctiva, okay? I'm going to pull your lower eyelid down. Alright, so conjunctiva is pink, no signs of redness, no signs of drainage or discharge, okay? That was your conjunctiva. Now I'm going to look at the sclera. The sclera is your white part, okay? And all I'm looking for are any signs of redness and discharge or drainage. Okay, so by the looks of it, your sclera is white, it's not red, and I don't see any signs of discharge or drainage, okay? Now the next part when it comes to inspecting your eyes or assessing your eyes, it's going to be involving your pupils, okay? So what I'm looking at when it comes to your pupils is size. I'm looking at the size. Okay, so the size of your pupils are within normal limits, okay? I'm making sure they're equal, which they are, and I'm making sure they're round, which they are. Next, I'm going to check whether or not they're reacting to light, okay? So what they should do is constrict and dilate when I shine a light at them, and I'll do that to the left eye, then the right eye, okay? Okay, so your pupils were reactive to light. They constricted and dilated when I shone the light in there and took it away, okay? Now the next part is I want to make sure that they react to accommodation, okay? That they can do it. So what I want you to do is I just want you to stare at this pen, and I'm going to move it closer to you and then farther away, okay? And I just want you to follow it. Okay, very good. And then can you read this first line up here for me?
ABCD.
A, B, C, D. All right, awesome. So I would say your pupil's size was appropriate or was within normal limits. They were equal, okay? They were round. They were reactive to light and accommodation, okay? So your eyes were good, all right? So the next is your ears. And what I'm going to do with your ears, I'm going to inspect your external auditory meatus, and I'm just going to look for any signs of discharge or drainage, okay? I'm going to check your right ear, then I'll check your left ear, okay? No signs of discharge or drainage in the right ear. No signs of discharge or drainage in the left ear. The last part of assessing your ears is called a whisper test, okay? I'm going to whisper a word in your left ear, and then I just want you to repeat it out loud, and then I'll do it in the right, okay? All right. So I didn't see any signs of discharge or drainage in either ear in the external auditory meatus, and I also don't see any signs of hearing loss because we performed a whisper test, okay? And you passed, all right? So the next part of the assessment is your nose. Now, when it comes to your nose, I'm going to inspect the internal structures, okay? And what I'm looking for are any signs of deformities, any inflammation to make sure it's symmetrical, okay? I don't see any signs of deformities. There's no inflammation, and it's symmetrical, okay? So that looks good. Now, the next part of this is checking bilateral patency, okay? So what I want you to do is just close your left nostril, breathe in and out of your right, okay? And then do it on the right side. Okay, could you breathe in and out of each nostril? Okay, so you have bilateral patency, so it's good, okay? The last part of assessing your nose is seeing any signs of discharge or drainage, okay? Of which I see no signs of discharge or drainage, so your nose is good, okay? The next part of the assessment is your mouth, okay? Your mouth and your throat. And what I'm looking for is your lips, your gums, and your tongue to be pink and have moisture, okay? So when I ask, I just want you to open your cheeks, lift up your tongue so I can see those structures, okay? Alright. So your lips, your gums, and your tongue were all pink, and they had moisture, okay? So they look good. Okay, Talon, so the next part of our assessment is the respiratory system, okay? I want to look at how you're breathing first. I want to make sure that you're not using any accessory muscles while breathing. As stated earlier in the interview or the assessment, accessory muscles would involve you leaning forward, tripoding, using your intercostal muscles while breathing, okay, or straining your neck muscles, showing that you're having problems breathing, or flaring your nostrils, maybe, okay. I don't see any signs of accessory muscle use while breathing, okay. So you look good. Now I'm gonna also take your lung fills, okay, and what I'm gonna do is I'm just gonna listen with the diaphragm on my stethoscope, and I'll just call out what portion of the lung I'm listening to, okay. Now this will be done in a Z pattern, and it would be done underneath clothes, okay? So the patient, I would not do it on top of clothes or on top of hair. If they have hair, I would just shave it off if I have to. So this is the right upper lobe. What?
I don't think you did the right thing.
I did. Right upper lobe. Left upper lobe. Left upper lobe. Right upper lobe. Left lower lobe. Right middle lobe. Right lower lobe. And then I'm going to hit that right middle lobe one more time right up here. Okay. So when listening to your lungs, they work clear bilaterally across all lung fields, okay? I listen to your left upper and lower lobes and your right upper, middle, and lower lobe, okay? Are you dizzy at all? Okay, so if you stand up, I'm going to listen to the posterior side or the back side. And like I said, this is all done in a Z pattern, okay? Underneath close. So this is your left upper lobe, your right upper lobe, right upper lobe, left upper lobe, left lower lobe, right lower lobe. Can you lift up your arm for me? Right middle lobe. Okay, Talon, are you dizzy at all? Okay. So right there, what we did is I auscultated your lungs. They were clear bilaterally across all fields, okay? I listened to your posterior left upper lung and left lower lung, or lobe, excuse me. And then I listened to your right upper lobe, your right middle lobe, and your right lower lobe. They were clear bilaterally with no abnormal sounds, okay? The next part of this is your cardiovascular assessment, okay? Now, when it comes to that, the first thing I'm going to check is your carotid pulses. Your carotids are located on each side of your trachea, just beside it, okay? Your trachea is right here in the middle of your throat. I'm going to feel your left side first, and then your right. I can't feel both at the same time because there's a chance that you'll pass out from doing it, okay? Okay, so I would rate your carotid pulses at 2+. Next, I'm going to assess you for JVD, or jugular vein distension. I'm going to lay you back at a 45-degree angle, and basically what I'm looking for are your jugular veins, which are pretty much on the side of your neck. I'm going to look for them abnormally bulging out, okay? Lay the patient back at 45 degrees. No signs of jugular vein distension. All right, you can sit back up. All right, sir, so now I'm going to listen to your lungs, okay? Not your lungs, I'm sorry, to your heart. Now, when it comes to listening to your heart, I'm going to call it the structure and its location, okay? And I'm going to listen to it with the diaphragm first and then the bell, okay? Like I said, this will be done underneath clothes, okay? So this is your aortic valve, which is right sternal border, second intercostal space. your pulmonic valve, which is left sternal border, second intercostal space, your tricuspid valve, which is left sternal border, fifth intercostal space, your mitral valve, which is left midclavicular, fifth intercostal space, and then Erb's point, which is left sternal border, third intercostal space. All right, Talon, we're listening with the diaphragm. I didn't find any abnormal sounds, okay? Now I'm going to listen with the bell. Now we'll do the same thing. I'll call out the structures and the location, okay? So aortic valve, right sternal border, second intercostal space. Pulmonic valve, left sternal border, second intercostal space. Tricuspid valve, left sternal border, fifth intercostal space. Mitral valve, left midclavicular, fifth intercostal space. And then Erb's point, which is left sternal border, third intercostal space. All right, Talon, I didn't hear any abnormal sounds with the bell either, okay? So I did that with both the bell and the diaphragm, and I heard no abnormal sounds, okay? So to close this out, I need to check your radial pulses. Your radial pulses are located on your wrist, thumb side, okay? And I'm just going to check one at a time, okay? All right, Talon. So I would rate your radial pulses at 2+, okay? So which is within normal limits. All right, Talon. So on a pain scale, again, just like before, 0 being no pain, 10 being extreme pain, how would you rate your pain right now?
0.
0. Very good. Okay, so I'm going to make sure your bed is locked, which it is. I'm going to make sure it's in its low position, which it is. I'm going to make sure the side rails are up, which it is. Here's your call light, sir. I want to tell you that I thank you and appreciate your time for allowing me to do your head and chest assessment. Do you have any questions? No? Okay, well, everything was within normal limits, and if you need anything, you just call me on that call light that I gave you, okay? You have no questions? All right, sir, thank you. And hygiene, done.